Let's see. Hello, Facebook. It's Bill, the Knee Pain Guru. Today we are going to talk about how to know if you have the right doctor for your knee pain. This is I believe, a topic that's worth having a conversation around, because I was fortunate enough to have a really great doctor. Orthopedic surgeon for the University of Louisville sports teams, Dr. John Ellis. He did a great job. He was able to diagnose my knee, that I had torn the ligament in my knee from the get-go. Had surgery. There's a whole other dynamics around that, but point being is I had a good doctor. But I work with lots of clients that end up having lots of problems with their knee, and there's 4 things I want to go over today. Welcome everyone who's joining this live feed. Please ask your questions below. Ask your questions below about knee pain, whatever you have going on, and I'm going to go into sharing about 4 things to look for to know if you have the wrong doctor for your knee pain, or whether you're dealing with the right doctor. The first one is going to be you make an appointment to go see a doctor about your knees. You want answers, and you pay for the appointment. You spend your time, money for gas. You may have to take off of work to go see the doctor, and then you walk out of the appointment with the doctor and you don't know anything more than when you walked in. What gives? So that is something to consider. If you're going to see your doctor and you don't know any more about your knee pain than when you walked in, there's a good chance you might be dealing with the wrong doctor for your knee pain. The second one, you go to see your doctor. They order an MRI, an X-ray, a CT scan, something to figure out what's going on with your knee. That's ordered. You follow instructions. You come back, the doctor looks at the MRI, the CT scan, or the X-ray, and the doctor's saying, well, your knee looks normal. You still have pain, though. There's a good chance you might be dealing with the wrong doctor. Something to consider. The third point, your knee's been in pain for a while. Could be weeks, could be months, could be years, and you're still in pain. And you have the same limited options. You're making those appointments to go see the doctor, you're leaving, you have no more information, the doctor can't tell you why your knee's hurt, and they're saying, get prescription drugs, pain-killing shots, exploratory surgery, physical therapy. And you've been in pain for weeks, months, years, and they're still giving you those 4 options as to what you could do. There's a good chance you might be dealing with the wrong doctor. So, another thing to consider. And then the last one, so you have these limited options that aren't working, and your doctor is resistant to giving you any other alternatives or being open to any other alternatives other than the conventional medical model. There is a good chance you might be dealing with the wrong doctor to help you with your knee pain. So it's something to consider. Those are 4 points to look at, to consider when you have knee pain and you've been in knee pain a while and you're looking for a solution. Sometimes the answers for knee pain do not exist inside the conventional medical model. You have to look outside of that approach of prescription drugs, pain-killing shots, exploratory surgery, or physical therapy to find a solution for your knees. It's just kind of like, well, it just makes sense, because ultimately you want to be out of pain. The only reason you are going to see the doctor is because you're in pain. And if the pain went away, you wouldn't see the doctor. You wouldn't be watching this video. You wouldn't be searching on the internet to find a solution. So something to consider. If this information sounds valuable to you, or might be valuable to someone that you know, please like this video, share it with your friends, like my Facebook page, thekneepainguru.com. Head over to my website. Take your first step. Go to thekneepainguru.com. Check out my 7-day knee pain reduction challenge. It gives you a video to begin working with your knee to see if creating comfort in your knee can be very helpful in terms of relieving your knee pain. So that's like your first step, little baby step. Ask questions. If you're here and you have issues with your knees, please ask questions down below. I'd be happy to answer them. I'm ultimately here to help and find a solution for your knee. And if something that I can offer can help, well then, great. Then we can work together. Okay, great. We have SACHA. What is the effect of total removal of the internal meniscus in the long term? It's difficult to say. Meniscus is designed like a shock absorber in the knee joint. However, there's an interesting concept introduced by a Harvard medical doctor named, Dr. Stephen Levine, that talks about this concept of biotensegrity or tensegrity structure. And tensegrity structure is what you would see like a bicycle wheel. The parts of the bicycle wheel, the tension from the rim and the hub and the spokes create the strength of the wheel. And if there is some spokes that are either loose or too tight, it makes the bicycle wheel not as strong, and the balance in the bicycle wheel is not as effective. This very same thing happens in the body. When we have excess tension as a result of the body compensating to protect itself from pain, or let's say a surgery that happens where the meniscus, part of the meniscus is removed, it shifts the tension in the body, and then that translates throughout the rest of the structure. This can create an imbalance. If we look at it from a very antiquated approach where it's like a foundation, we have a first floor, second floor, third floor, then you can get pretty stuck in finding a solution. However, when we look at the body as a tensegrity structure, we can begin to understand how the nervous system is playing a role in that shift of tension throughout the structure. By creating comfort, we bring the structure back into balance, and in doing so, we can alleviate the pain and set up the conditions so the body can move very smooth and fluid. So it's difficult to say what are the long-term effects. I don't know. I had 2 pieces of meniscus removed from my left knee. I have had buddies and I've worked with clients that have had surgeries before me and after me, and I'm moving better now using how I've helped myself and thousands of clients better than most of those guys that have had surgeries, a very similar type of surgery. So the key is creating comfort, reducing the stress and tension in the nervous system, setting up the conditions in the body so the body can heal itself. And ultimately what it does is it sets up the conditions so you can live your life and you're not thinking about your knee all the time. Welcome everyone who's here. If you'd like to ask questions below regarding your knees, what situation that you're dealing with, I won't be before you too long, as I've got to scoot here. I have a few things to do this morning, but I did want to share this because it seems to be kind of a white elephant in the room, whether you have the right doctor. Yeah, I'm not a doctor. Anyhow, I've had extensive training as far as body work and things such as that, but in terms of the conventional medical model, that wasn't something that I was interested in pursuing, as I was finding I was getting better results outside of that. Medical model has a very valuable role, especially if something is broken or torn. They have their role, but where I see their role ending is that they, if there's just pain, and there isn't something broken or torn, there isn't a mechanical dysfunction, what ends up happening is you get into a pain management type of cycle, which leads down the road to more pain and really not having a solution for your knees. So I'm going to wrap it up for today. I don't see any more questions coming on here. If you'd like more information, head over to my website, thekneepainguru.com. Take the 7-day knee pain reduction challenge. They just cure the pain, but not the global problem. They don't necessarily cure the pain. And they're not really curing the pain. The body cures the pain. The doctors ideally facilitate that process. They numb the pain. Doctors will use drugs which numb the sensation in the nervous system. Shots numb the sensation in the knee. Surgery is ideally there to remove what is broken or torn in the knee, so the body is mechanically sound. And physical therapy, the idea is that they're bringing the body back into balance by strengthening the weak muscles. However, that doesn't necessarily address the issue if the nervous system on a fundamental level is tensing up to protect itself. So it isn't like we have to strengthen what's weak. We need to relax what's tight. And when we relax what's tight, what ends up happening is the body gets out of pain, and then we could look at strengthening from that point moving forward, from a place where the body feels balanced and comfortable and not in a constant state of fear that something is going to hurt. There isn't that doubt in your mind that the way I'm going to move is going to cause me more pain. And if it does, then having the tools to knowing how to get yourself out of pain is incredibly valuable. So, this is Bill Parravano, the Knee Pain Guru. Going to sign out for today. I do these videos daily, short ones talking about a different topic. Thank you so much for being here. Thank you for asking the questions and interacting. If you have anything else or you see this video later, please type questions in below. I will see them and answer them on this thread or on another video that I shoot. Thank you so much. Have a great day. Talk to you soon.